The following program is sponsored by Capital Blue Cross. El siguiente programa es auspiciado por Capital Blue Cross.
Bienvenidos amigas y amigos a otra cita con su salud. Quien les habla, José Urdaneta, complacido nuevamente de que estén aquí conmigo para conversar sobre temas importantes acerca de nuestra salud. Cuando nos estamos acercando a los 65 años, la edad de retiro, comienzan muchas preocupaciones con respecto a si hemos ahorrado suficiente para el retiro, si hemos hecho suficiente para retirarnos cómodamente, pero una de las preguntas más importantes es ¿qué va a pasar con mi salud? ¿Qué cosas tengo que hacer para asegurarme de que mi cobertura de salud continúe sin problemas después de que yo me haya retirado? Sea que lo voy a hacer inmediatamente a los 65 o poco después o años después de los 65 años. Para hablar sobre este tema importantísimo tenemos aquí con nosotros a Toya Platter, quien es una representante de Capital Blue Cross en asuntos de ventas de seguros de Medicare. Ella nos va a estar conversando exactamente de qué es lo que nosotros tenemos que hacer para asegurarnos de que estamos cubiertos. Toya.
Hello.
Such a pleasure to have you here with us again in Cita Con Su Salud.
Thank you for being here.
It's a pleasure. So tell us, Toya, I was just saying that, you know what, I'm 64 and I'm getting ready to retire. How do I make sure what is out there? And we know it's Medicare, but is there something I have to do? Is there somewhere I have to go to make sure that I have a seamless coverage of my health care needs?
So basically, if they're getting ready to retire, you want to make sure, number one, are you going to collect Social Security? If you're going to collect Social Security, there's not going to really be anything for you to do. Your Part A and your Part B information will come to you automatically. Mm-hmm. If you're not going to collect Social Security and you say, okay, I'm going to retire, mm-hmm. You're going to go down to your local Social Security office and you're going to get with someone down there and they will help you go through it by signing up for your Part A, which is your hospital, and your Part B, which is your medical.
So this could be, for example, someone who is going to retire from their job, mm-hmm. but is going to continue with their own business.
Correct.
So they're not going to collect Social Security, but now I'm going to work for myself. I want to make sure that I have health care.
That's right.
Okay, so I can go to the Social Security office. And what do you mean by Part A and Part B? What are these?
Well, Part A is your hospital. Mm-hmm. So that's your inpatient hospital care.
It's your coverage for hospital needs.
Yes, it's your coverage for your hospital needs. And that is given to a person that is turning 65. Mm-hmm. That is given to you free as long as you worked 40 quarters.
It is what we call an entitlement.
Yes, as long as you worked 40 quarters.
40 quarters.
Or more in your lifetime. Mm-hmm. Okay?
Paying your taxes, contributing to this entitlement pot so that you can get something out of it.
Exactly.
Okay.
Exactly. And then you have the B, which is Part B. That is your medical or your doctor.
Doctor's visits.
Right. If you're going to continue to work, you don't need to pick that up right away. But if you're not, and you're going to collect everything, your Part A.
If you're going to continue to work with benefits from your job.
Correct.
But if you're going to continue to work and you're self-employed, then you still need it.
Then you need it, right.
Yes.
If you have benefits with your job, no, you don't need it because that cost. So there is a cost for that. So you don't want to pay the government for something that you don't need to pay the government for.
So Part A is free.
Part A is free.
Part A covers hospitalizations, correct? And Part B is your doctor's visits.
Correct.
And that costs additional. That is something that you would have to set up. And what is the average cost? What is the cost for Part B?
About $104.
$104. Is this something that is, until I die, I'm going to be paying $104 per Part B?
Pretty much, yes. It's $104. It normally will come straight out of your Social Security if you're collecting Social Security.
It doesn't change year by year?
Every year it could change, or every year it could stay the same. So the government makes those rules.
Those rules.
Mm-hmm.
So
they let us know, and they let the nation know.
and then you write the check.
Right, right.
One way or the other.
They're going to get it.
They're going to get it. So now, Part A and Part B, do they cover 100% of hospitalization, 100% of your doctor's visit?
No. Part A and B only cover 80%.
80%. So there is a 20%. I mean, when you say, if I'm going to the store and they tell me that it's 80% discount, it sounds like I got to buy 10, right?
Oh, right.
But when you're talking about healthcare and you're saying only 80%, 20% can be a huge impact.
Oh, my gosh.
Correct?
At the hospital, $100,000, you go get a stent put in your heart.
That's $20,000.
20, or if not 100 sometimes, $100,000.
$100,000.
It can be $100,000. 20% of $100,000?
That's what I mean.
Oh,
it's $20,000 that you would have to come out of your pocket.
Out of your pocket.
So when you're going to the store and they tell you that you have 80% discount, sounds like a lot. But when you go to healthcare and they tell you it's only cover 80%, you better worry about those 20%.
That's right.
How? If I am ready to retire and I need to make sure that that 20% is covered, what is out there for me? What is it that I need to do?
So then basically, once you figured out, I am going to retire, I'm not going to keep working, I went to the Social Security office, I signed up for Part A, I signed up for Part B, I signed up for my Social Security, I'm good to go. Now I need to figure out, how am I going to fill, I call them holes. How am I going to fill in those holes or gaps that Medicare will not pay?
So instead of eating a donut, I want to eat a hamburger. That is the complete bun, correct?
Yes. That was good. That was good. Yes, the complete bun, right. How am I going to fill in those holes? And that's where the supplements, that's when they could call Capital Blue Cross.
So that's what we call the supplements.
Supplements.
So you are actually, it's up to you if you want to pay that 20% out of your pocket or if you want to shop around and say, I want to find the best supplement possible that is going to cover the additional costs that Medicare does not cover.
Right, and you don't have to, but you don't have to do it. But because a lot of people, again, they think that they're healthy and they don't have to do it. But if something does come, and again, that heart, you have to get a stent, $100,000.
$20,000 out of your pocket.
There you go.
That could be your whole. That $20,000 is sometimes a salary with which a person lives the whole year.
Yes, it has bankrupt people.
It has. Yeah, it does. So, like with anything with insurance, you know, you're glad to have it and not need it, but certainly are very happy to have it when the necessity comes around. So, now, this is where then, and this is why we understand that out there. Because it was something difficult for me to understand. Why are insurance companies spending so much money in advertising? Now I understand, because it is my responsibility to find the best one for those kinds, that 20% additional out there. It's not covered. It's up to me to find that out and find the best plan.
Find the best plan for you.
So this is where you come in. This is where in trying to explain what is it that you have available for people and say, you know what, this is what we would cover and this is how much this is going to cost.
Right. So when a person would call in and they would want me to come out to see them, or they would come to, we offer seminars. So if they would come to a seminar, we would actually sit down and we would talk to them, especially if it's one-on-one. We would talk to them and then I would get their needs. Okay, fine, you're retiring. Okay, tell me what kind of insurance you had, because a lot of people want the same exact insurance that they had when they were working.
The same type of coverage.
Oh my gosh,
the same type of freedom that they had.
Yes, because it was so easy. But I have to explain to them, Medicare is just a little different.
That's the government, right?
Yeah, it's just a little different. So now what we have to do is try to get as close, and that's what we do at Capital. We try to get as close as possible to what they had. You know, but I mean, we have to tell them there's going to be some differences, because what you had as a group is totally different than what you're getting individually.
Okay. Bueno, damas y caballeros, estamos hablando con Toya Platter de Capital Blue Cross acerca de exactamente qué es lo que tenemos que hacer cuando estamos acercándonos o cuando ya estamos en la edad de retiro, si queremos que nuestra cobertura de salud continúe sin ningún problema. Lo principal es necesariamente si nosotros nos vamos a retirar y vamos a comenzar a recibir el Social Security, la seguridad social, del gobierno. Eso quiere decir que hemos trabajado por lo menos 40 trimestres en nuestra vida, esos son 10 años, contribuyendo a los impuestos y al gobierno federal para poder recibir este beneficio. Entonces, eso automáticamente cuando estamos recibiendo nuestro cheque del Seguro Social, eso inmediatamente nos da la cobertura de Medicare. pero algunos de nosotros nos vamos a retirar de nuestro trabajo, pero vamos a continuar con un negocio. Es decir, no vamos a recibir el cheque del Seguro Social, sino que vamos a continuar trabajando de alguna u otra forma. Entonces, nuestra responsabilidad conocer de que el Medicare tiene dos partes automáticas, vamos a llamarlas así, que es la parte A y la parte B. La parte A cubre sus hospitalizaciones, los gastos de hospitalización. Entonces vamos a decir que a mí me tienen que hospitalizar porque me van a operar de cálculos en la vesícula. Entonces, mi Medicare me va a cubrir el 80% de esa operación automáticamente. Pero luego de eso yo tengo que tener unas visitas al médico. Las visitas al médico las cubre la parte B. La parte A es completamente gratuita, la parte B yo tengo que pagar una cantidad que Toya nos dice que en estos momentos son aproximadamente $104 al año y que cambia. Esa es una cuota que la pone el gobierno. Cada año puede cambiar, puede aumentar usualmente o puede quedarse igual. Entonces, pero tanto la parte A como la parte B tienen solamente una cobertura de 80%. Es su responsabilidad el otro 20% de lo que su hospital le cobre o en el caso de las visitas médicas de lo que su médico le cobre. Obviamente, cuando estamos hablando de una venta especial en una tienda y nos dicen 80% de descuento, nos parece que es, wow, hay que comprar 10 de estos porque 80% de descuento es bastante descuento. Pero cuando nos están hablando de que tenemos que pagar 20% de nuestros gastos médicos, cuando, por ejemplo, tenemos una operación de corazón abierto y cuesta $100,000 y entonces de nuestros bolsillos tenemos que pagar $20,000, la situación cambia. Entonces, cuando nosotros tenemos que comprar o buscar el suplemento para el Medicare, que es donde las compañías de seguro y personas como Toya vienen a la luz de nuestras vidas para asegurarnos de que estamos comprando el mejor suplemento posible. Vamos a averiguar un poco más sobre esto. Now, Toya, when you say that people want the same health care that they had while they were working, right? A lot of things that we want is not to have to change doctors.
Exactly.
Correct? That's the most important thing. This is the person that I've been going to for 20 years and knows my history, knows my family. When I get there, he can even ask for my dog by name and last name. Right?
Exactly.
So
right.
That is one of the first things that I want to make sure that is covered. How do I do that? And is there a list that you give people as to what your supplement insurance is going to cover? Is it different from what Medicare or because your doctor would have to accept Medicare, correct?
Right. Mm-hmm. So basically, when I would just sit down with someone, I would have a huge book, about this big, okay, of all of our doctors, because we have a vast amount of doctors in our network.
Okay.
So, and we would look up the doctors, each doctor, to make sure that the doctors are in the provider network.
And usually it's not just one doctor. I mean,
No.
especially as we get older, we have a doctor for our heart, a doctor for our, diabetes and many different situations that we might have with our health.
Right, like the hospital. The hospital is important, especially being down here in Lancaster. The Lancaster General Hospital. We have Lancaster General Hospital now.
Yeah.
So that's great. That's and to some people, because that is one of the biggest hospitals down here. That's important.
Yes.
They don't want to go to another hospital.
Exactly.
They don't. So
it's where your baby was born. Is where you had all your surgeries or whatever you want to continue.
And they have reasons, whatever their reasons are, and they want that hospital. They want to be able.
When it comes to healthcare, it's about trust, correct?
It's about trust.
Exactly, and change is usually something a little difficult when it comes to trust.
And when you're retiring, you have to understand that they didn't have to do anything. Their human resource did everything for them. Here's the paper, sign. You have 15 days, sign the paper, and that's it. Now, okay, I'm on Medicare. I have to do this. I have to do what? And then that's where we come in because we want to help them navigate.
So, supplement. What is this supplement called? Because we call one Part A, Part B. What is the supplement? Is there a name for it?
Yes, it is. So you have Part A and B, and like we said, that only covers 80%. So then we have to find something to fill in the holes that Medicare doesn't pay. That's the 20. So a lot of people put them underneath a big umbrella called supplement, but there are names.
Okay.
So the first name I'll give you is what they call a Medicare Advantage.
Okay.
So a Medicare Advantage plan is a PPO. So ours is called Senior Blue PPO. Okay? So that is a Medicare. A Medicare Advantage plan is ran by the insurance company.
Okay.
Okay? The Advantage...
This is no longer, we're not talking about government, this is the part of your coverage that it's going to be private.
Exactly. It is ran by the insurance company. You have one card. You show the doctors one card. You show the hospital one card. You show the pharmacist one card. That's it.
That's it.
That's it. You still have Medicare, but it's ran by the insurance company.
It's under that card. It's just like you did it when you were working. One card, that's it. That's all you need to carry. You don't need to be carrying multiple cards.
That's correct. That's correct. So that is called a Medicare Advantage plan. Yes, and the advantage to that, as how I explain it to people, the advantage, when you hear the word Medicare Advantage, the advantage is your Part D, which is for drugs.
The medication.
The medication is already wrapped up into that.
Okay.
It's already in it. You have one card and everything's there.
So it's one card not just for the hospital, not just for the doctor, but also for the pharmacist.
It's for everything.
Okay.
Yep. So that's what I try to tell people. You know, when you hear the word Medicare Advantage, and I know you're seeing a lot of things, Medicare Advantage, everything's all wrapped up into one.
All wrapped up into one thing. Damas y caballeros, aquí viene la primera parte. Exactamente, si alguno de nosotros quiere que nuestra cobertura de Medicare sea lo más similar a lo que estábamos recibiendo de nuestro trabajo, viene lo que se llama el Medicare Advantage. ¿Okay? Son unos planes. El Advantage, esa palabra significa ventaja en inglés. Entonces la ventaja es que toda la cobertura de Medicare, recuerden que estábamos hablando de la parte A y la parte B, hay una parte que se llama D, porque cuando hablamos de salud, no solamente ir al doctor, no solamente poder ir al hospital cuando nos toca ir al hospital, sino después las medicinas que tenemos que tomar para mantener o recuperar la salud. Entonces, estas medicinas no están cubiertas ni por la parte A ni por la parte B, sino que necesitan lo que se llama el Medicare, la parte D del Medicare. Y esa parte D, el Advantage, la ventaja de este programa es que con una sola tarjeta, usted presenta esa tarjeta en el hospital, presenta esa tarjeta al médico y presenta también esa tarjeta a la farmacia cuando usted va a comprar sus medicinas y sus medicinas están cubiertas. Is this 100% coverage for medications and for everything depending on what you have bought, I guess?
No.
No?
No, you still will have small copays.
Copays.
Yes, you'll have small copays.
Just like we did when we were working,
exactly.
Correct? There's a copay.
Exactly. You'll have small copays and things of that nature, but nothing like to 20%.
Nothing like 100%.
Exactly.
Correct?
Exactly.
I mean, we usually, as the middle class, we're usually one medical emergency away from bankruptcy.
Oh my gosh, yes.
Correct? It's all it takes is just one.
Just one.
Not being adequately covered.
Just one.
It's all it takes. And sometimes not just ours. This is a very important conversation, Toya, because sometimes it's not just our economy that it's probably our kids who will come to our rescue and end up jeopardizing their ability to feed their kids and their families because we have, as parents, a medical emergency.
Right. Or even
children.
Our parents.
Our parents. Everyone. It becomes a family emergency when someone is really in jeopardy with their health and nobody wants to leave us hanging, as they say, and they all want to come to the rescue.
And a lot of people don't want to talk about it because they don't want to think that far ahead. They don't want to no, I'll be okay. But when that one thing comes and then we're at 20%, feels like 100%.
Exactly.
It does. And it's scary. It can be scary. And we don't want this to be scary.
Probably we can look back when somebody told us that our sons or daughters got a 50% scholarship for college, and you realize that the other 50% is still a heck of a lot of money, right? And that's exactly how healthcare is.
Oh, it is.
I mean, 20% of that is still a heck of a lot of money out of pocket when you're talking.
It's a lot. And it's a lot for those that are on a fixed income. If you're on a fixed income and you're not allowing for that to come up. You're not allotting for 20%. Now what?
You don't know which part of the machine is the one that's going to give you problems.
That's right.
And
That's
certainly
right.
you have to prepare for all of it. Now, Tonya, we hear a lot about something that's happening exactly as we speak, which is the open enrollment period.
That's correct.
This is happening right now. So this is for people who are already receiving Medicare. Toya, what should they be doing? What does open enrollment mean? It started on October 15th, correct? And it goes until November 7th.
December 7th.
December 7th.
That's okay.
Great,
That's
thank you.
okay. That's okay.
So December 7th. So what's happening during this time, and what are retirees shopping for during this open enrollment?
Okay. The annual open enrollment time, which is, like you said, October 15th to December 7th, it is for people that are already on a plan or people that have never chosen a plan, okay? And what they want to do right now, so for someone that is already on the plan, on a plan, our plan, doesn't matter, this is the time when they want to take those looks and look at those commercials and make some phone calls and find out, okay, am I on the best plan? The plan that I've been on for this past year.
So it's not an accident that when you turn the TV, there's a lot of commercials for Medicare plans, because this is the moment.
This is the moment where people, this is the time that you can switch. This is the time where you can make some changes.
So once December 7th comes in, you're stuck with what you have.
You are stuck unless you have a qualifying event. Something had to have happened. You moved out of the area. You started working. You got some. You have to have a qualifying. Some kind of qualifying event.
But in general, you're stuck with what?
In general, you're stuck.
If you did not do your homework between this time, what kind of homework should people be doing right now? Let's just say that I feel, I'm happy with what I have. I don't need to do it. What should I really do something or not?
If you told me that you were happy with what you have, you would not need to do anything. You would just roll right over. But what I would still tell you to do is let's make sure that all of your doctors are still in the network. Nothing has changed. You normally would get some literature telling you that the doctors have changed, but you might have missed it. You might have missed it.
Yeah.
So you want to make sure your doctors have changed. Always, always, always check your medicine. Always check your medicine, because your medicine can change from year to year. Okay, it can change. It can, be this price one year. It can go down, be another price next year.
Toya, I've had my doctor with my regular insurance have to change from one medication to the other because my insurance stopped covering
exactly
XYZ medication.
Perfect example.
Yes.
That's exactly what I would want. I would want them to do it. Well, Toy, I'm not. They may say, Toy, I'm not on a lot of medicine. Okay, but the one or two that you are on, I want you to check them out.
Check them out.
Check them out, please. Because that can change, and that can, if your medicine has went up tremendously, okay, on this plan that you're on right now, everything else looks good, but your medicine went up tremendously, that could hurt your pocket.
Exactly.
We need to look at that.
If your copay, if your medicine went up, then that means that your copay went up too, right?
Exactly.
Yes.
Exactly. So that's something that they want to look at as well.
So you might be, and then the other thing is that a lot of times we're happy with what we have because we don't know what's available out there, right?
That's correct.
So you may think that you're happy with what you have, but something out there could make you even happier.
Even happier, right. And that's why people, they see the commercials, they make the calls, And what we try to do is when we get those calls in and they say, okay, well, I'm on XYZ insurance, I think I want to leave XYZ insurance. We make sure as a company, we just make sure before you jump ship, we're going to explain to you what we can offer, but we make sure that we look at everything.
So that you're not going from the frying pan to the hot pot.
That's right.
Yes.
That's right.
Yeah.
Because
you just don't know what's out. Now, what are you doing as a representative for Capital Blue Cross in terms of Medicare? What are you doing to inform the public of what you have available and what's out there?
Well, along with all the advertising that we have, the different commercials, the advertising in the mail, we are also putting all of our seminars out in the newspapers and things like that. People will call in after they see these advertisements. They will call in and they may say they want someone to come to their home. And I will will go and do a home visit. Yes.
So they can sit down and evaluate the plan that they have and compare it with what you have to offer, and you will honestly say, you know what, I would recommend that you switch, or say, you know what, it's not convenient.
Exactly. Just like we're sitting right here, that's exactly, we'll be in the kitchen.
Okay.
You know, we'll be in someone's kitchen, their medicine will be on the table, you know, we'll evaluate the medicine, we'll evaluate the plan that they have on, that they're on now. They may be on my plan, you know, we'll evaluate that, and we go over every detail.
Every detail
We
of their
go over
healthcare needs.
Their healthcare needs, their needs, if they're going to be doing a lot of traveling, everything. We
Even
evaluate.
transportation, I guess, is
Just
an important part,
everything,
right?
Everything.
How do you get to the doctor? How do you get to your doctor's visit? How do you get to the pharmacy?
Yeah, what
All
are
those
you
different
doing?
things.
Yeah, are you alone? Are you by yourself? You know, because that just tells me how deep I have to go.
Okay.
How deep I have to go. But
How does someone get in contact to say, I want Toya to come to home visit and help me out in figuring this out?
oh, they would just call 1-800-990-4201, and they would get a sales rep, and they would just say that they would like to speak to Toya. They would like to have Toya come to their home, or, you know, if I'm not available,
Any of the
another
other
one.
reps. Now, in terms of, how about online? Can they go online and do something with
They
that?
can go online to Capital Blue Cross Medicare.com.
Okay. So, en capitalbluemedicare.com, correct?
Yes.
Bueno, damas y caballeros, la situación es que en estos momentos estamos en el periodo abierto de inscripción para Medicare, que comenzó octubre 15 y va hasta diciembre 7. Este periodo de inscripción abierto es para aquellas personas que van a recibir Medicare o que ya lo están recibiendo y que necesitan cubrir ese 20% adicional, conseguir el mejor programa que va a cubrir sus necesidades médicas. Es por eso que hoy usted está viendo televisión y hay tantos comerciales para este tipo de servicios de todas las agencias. ¿Cómo saber usted cuál es la mejor opción que usted tiene? Para eso existen personas como Toya que están haciendo incluso visitas casa por casa. Si usted llama a Capital Blue Cross al 1-800-990-4201, 1-800-990-4201, o usted va a su sitio web que es capitalbluemedicare.com, capitalbluemedicare.com, eso es una sola palabra. Allí usted puede conseguir cuando ellos tienen seminarios, cuando ellos tienen diferentes lugares donde pueden contestar sus preguntas y cómo hacer que una de estas personas como Toya tenga una conversación exactamente como la que hemos tenido nosotros aquí en nuestros estudios hoy, pero en su cocina, en su casa, evaluando sus medicinas, sus médicos y toda esta serie de cosas para que usted decida, ¿vale la pena que me cambie esta compañía o que me quede con lo que tengo y tome una decisión que es tan importante? Recuerde que cada uno de nosotros usualmente está bien económicamente hasta que viene una emergencia médica. Una emergencia médica puede afectar su economía, la economía de sus hijos, la economía de sus padres, la economía de toda la familia. Porque cuando estamos enfermos, todos los que nos quieren ayudar. Entonces, ¿por qué no asegurarse de que su seguro de salud esté cubierto de verdad para su futuro y para que usted así de esa manera pueda continuar acompañándonos aquí en Cita con Su Salud? Toya, thank you so much. This is such a great conversation.
You are so welcome.
Absolutely. A ustedes, damas y caballeros, será hasta la próxima Cita con Su Salud.
The following program is sponsored by Capital Blue Cross. El siguiente programa es auspiciado por Capital Blue Cross.